President of the Ghana Medical Association, Professor Ernest York, made the call at the association's 26th annual public lecture on the theme Food Safety in Contemporary Ghana, Public Health Concerns for the Consumer. He welcomed the Environmental Protection Agency's decision to phase out styrofoam products, describing it as a major environmental and public health intervention. Professor York, however, stressed that government must expand the policy to cover all single-use plastics in order to effectively reduce toxic pollution and safeguard the environment.
That the proposed ban must be expanded beyond just the styrofoam products to include single-use plastics in order to achieve a comprehensive solution. From the perspective of public health, this discussion extends beyond flagging. Food packaging should protect food from contamination without creating additional environmental hazards. As healthcare professionals, we support the adoption of packaging materials that are safe, environmental, sustainable, affordable, and practical for consumers and for food vendors alike.
He explained that food packaging should protect food from contamination.
Well, I am a doctor, so I see mostly the end of the story when things go bad usually, and patients come to the hospital from unsafe, food choices and also unsafe environmental practices. But I think the story starts from before they get to the hospital. Usually from the production and farmers, what they do, the use of pesticides, transportation, storage, and also the application of certain chemicals and toxins, ostensibly to improve the food quantities, the yield, and also for preservation. But these we have learned today that sometimes they carry some risks to the consumer. And therefore, we find this dialogue today, the public lecture, quite timely.
The lecture also highlighted concerns over unhealthy diet. Professor Amos La of the University of Ghana School of Public Health urging policymakers to treat ultra-processed foods as a major public health threat.
Food is not healthy, it is not safe, and therefore not food. To be able to, respond to that as a country, to address the problem of ultra-processed food, which obviously is unhealthy, and therefore we are saying is not safe. It ought to be all of government, approach. Although the Public Health Act identify the Food and Drugs Authority as the agency within the Ministry of Health with this responsibility to enforce, food safety intervention in the country. One agency alone would not be able to deliver
Eastern
on this.
Regional Minister Rita Kosua-Jiawate admonished all stakeholders in food value chain to adhere to safety standards to avert health consequences for consumers.
Food processors must observe proper manufacturing standards. Transporters must ensure hygienic handling.
Reporting for GH1 TV and Star FM, Kujansa, Kofredia.